Guys, so ischioanal fossa, or the old name would be ischiorectal fossa.
Which page? 20.
6. Alright, so the old name would be ischiorectal fossa. That's what you have in your topic list. So basically now we're talking about the anal triangle.
And the name you wrote here was issue.
Yeah.
Issue in.
So the thing is that ischioanal fossa is defined by the region or by the space around the anus. Alright? So the whole space over here, all of it. Here and here. The name is telling you ischioanal. So it means it's a space laterally bounded by the ischium, medially by the external anal sphincter muscle. Anteriorly, what about it? Body of the pubic bone. Okay? The thing is that ischioanal fossa anteriorly is kind of getting extending toward the where? Urogenital triangle. Okay? So the anterior continuation or anterior extension of ischioanal fossa is defined as anterior recess. You remember this picture I showed you? I told you that this triangular region is in the deep perineal pouch is the ischioanal fossa. I define it like that. So basically the anterior recess, the anterior extension of ischioanal fossa extends to the deep perineal pouch. Okay? Now, if we can just continue with that, so we have the external anal sphincter as the medial border, and posterior border is going to be the sacrotuberous ligament, and of course, gluteus maximus muscle that you would have it here, like that, like this white region that I made. So posterior border is going to be the sacrotuberous ligament and gluteus maximus muscle, like the white region I made.
But from outside.
Yeah, because this is the inferior view that we are looking at. All right. So then, two ischioanal fossae, they are communicating with each other. So left with the right side. How is it possible? So here, you've got the anococcygeal ligament or anococcygeal body. The thing is that as you're having the arrow located here, so over the anococcygeal body, there is a space posterior to the anal canal, which is called post-anal space. Makes the two ischioanal fossae to communicate with each other. Alright? That's it. So this is pretty much about the ischioanal fossa. What do you have there? Fat. Large amount of fat which is surrounding the anal canal. And also, if you're looking at the coronal section here, check it out. So here's the external anal sphincter, and here is the, let's say, levator ani muscle. So here's the ischioanal fossa. So if you imagine that the fats are removed, there is also nerve and vessels you're gonna find. Inferior rectal nerve and inferior rectal artery and vein. They are also found in the ischioanal fossa. That's it.
And what connects them?
Which ones?
The two fossas.
There's a space which is called post-anal space.
Post-anal.
Yeah, that's it.
And what was the borders again?
So laterally ischium, medially external anal sphincter,
Okay.
posteriorly sacrotuberous ligament and gluteus maximus muscle, anteriorly body of the pubic bones, right and left side.
So it's on the whole thing. It goes till anterior.
Yeah, but still it's gonna be kinda like just a recess anteriorly. And lateral border, to be more specific, it would be, let's say, the obturator fascia, the lower margin of the obturator fascia, over the ischium. Like that's more accurate. Okay, because here's the obturator internus muscle, and here's the obturator fascia covering it, so on the lower part of it. Like, that's also something else to mention. So there is another picture in the next page, which is good. So here it is. So again, this is the coronal section. So here is gonna be the, let's say, external anal sphincter. Here is the inferior fascia of the levator ani, so on the more posterior side. Now the whole, let's say, genital organs are removed, so the cut is more posteriorly. Okay? So then, as you see, the superior border is gonna be whom? Inferior fascia of the levator and ani muscle. Okay? On the lateral side, next to the ischium, you can mention also the obturator internus fascia. Okay? Now, one more thing that they can ask you in the ischio-anal fossa is this guy. Pudendal canal or Alcock's canal. Okay?
It's the same?
Yeah. Pudendal canal, the name is telling you. You've got the pudendal nerve, internal pudendal artery, internal pudendal vein, plus nerve to obturator internus. They are running together within the obturator fascia, as you see here. Okay?
Nerve to obturator internus is from sacral plexus.
It's from sacral plexus, but has nothing to do with the
The obturator nerve.
with the obturator nerve or with the pudendal nerve.
We
Yeah.
didn't draw
What
it
do you
when we
mean?
did the thing.
Yes, nerve to.
I just wrote it in
No,
green
no.
color.
Oh,
What do
okay,
you mean?
yeah.
It's not. What is it again? Obturator
So,
nerve?
check it out. Obturator nerve has nothing to do with the obturator internus muscle, okay?
Only for
Because it
external?
supplies the medial muscles of the thigh and external.
Okay.
So forget about that. In order to supply obturator internus muscle, I told you that we have nerve to obturator internus. Okay? So how does the nerve is reaching to the muscle? So you have the pudendal canal within the obturator fascia, contains pudendal nerve and internal pudendal vessels, plus nerve to quadrat, plus nerve to obturator internus.
Internal pudendal nerve is not there.
And
No, there is no
where it
internal
comes?
pudendal. There is only one pudendal nerve
Yeah.
and internal pudendal vessels.
There's no internal pudendal.
No, no.
Okay, okay.
Okay, so it's really important.
Yeah.
If you mix it up, then
There's
From
also the
where?
external
could
pudendal, which comes from
there
the
is external pudendal vessels. Okay, vessels are internal and external. Nerve, there is only one,
Pudendal.
only pudendal.
Okay, but obturator, the nerve to obturator internus, from where it comes?
Sacral plexus. Yeah.
And just passed through the canal.
Yes, so because the canal is the connection way also to the obturator internus muscle. So it makes sense. So how is going to be the pathway of the nerve and vessels? Check it out. Here's the origination of the pudendal nerve, passing through the greater sciatic foramen over here to the gluteal region, then making the way to the perineum through the lesser sciatic foramen here. So once the pudendal nerve enters the, can you see these dotted lines here? So this is the pudendal canal, okay? So once the pudendal nerve enters the pudendal canal, it gives you the inferior rectal branch toward the lower part of the anal canal and external anal sphincter. Okay, so this the first branch is inferior rectal branch. Good. Then the nerve continues. It's gonna be giving you a perineal branch, and it's gonna be giving you the dorsal nerve of the penis or clitoris. Okay? The perineal branches, how are they gonna be? The perineal branches, at last, they're gonna be dividing into superficial and deep branches. Okay? Superficial means what? Toward the skin. What have we got here? So here's the perineal branch, and this is gonna be the superficial perineal branch toward the scrotum. So posterior scrotal nerves. The homologue of the scrotum in the female is labia majora. Okay? So then, in the female, you will have posterior labial nerves to supply the labia majora, the skin of it. Are we good? Then, the deep perineal branches, the name is telling you, they will supply the perineal muscles. Ischiocavernosus, bulbospongiosus, transverse perineal muscles, and so on.
And deeper in the muscles.
Yeah, like these are the ones. These are the deep perineal muscles. All right? Was it hard? Artery is the same thing. Is the next page. So here you have the internal iliac artery. Let me change it to blue. So you've got the internal iliac artery. Again, passing through the greater sciatic foramen and lesser sciatic foramen to the perineum. And then internal pudendal artery gives you the inferior rectal branch. On its way, it almost, let's say, it follows the same rule. Dorsal nerve and perineal branch. So here you get posterior scrotal artery, same as posterior labial artery in the female. You get one artery to the bulb of the penis.
Wait, is this still from the anterior branch of the internal iliac?
This guy, yes, is from anterior branch, anterior division of internal iliac. So internal pudendal, after giving these branches, like the inferior rectal and scrotal, you have artery to the bulb of the penis. Okay? And then, in the case of the penis, you're gonna have the dorsal artery of the penis and deep artery of the penis. Deep artery of the penis is the main guy for erection. Because deep arteries, how many of them you've got? Two. Because you have two internal pudendal artery. Dorsal arteries, how many you got? Two. Because you have two internal pudendal arteries, so you will have a pair of arteries to the penis. Same thing with the clitoris. The dorsal artery of the clitoris
So why
is the
only
same
the
thing.
deep is for erection?
Yeah, the deep one is the main one for the erection because it enters the corpus cavernosa, one on each side. So
That's
these
why
are the
you have
ones responsible to fill up the blood to the corpus cavernosum so erection can happen. Are we good with that?
Just the internal pudendal is continuation of the anterior, of the internal.
Is a one branch to the terminal branch because
This is the terminal,
the terminal branch would be inferior gluteal.
okay.
This is the one to the last. Okay? One more thing just for your own sake to know or for your own knowledge is that pudendal nerve is a nerve to be damaged the most in the professional cyclists.
Which
Professional cyclists like the the bicycle
Tour de France.
the professional sports.
Lance,
Tour de France. and
Lance
things like
Armstrong.
Why? Because ischial tuberosity is here, right? This is the here's the ischial tuberosity. The nerve is running medial to it.
Yeah.
Yeah, ischial tuberosity, so the nerve is going around and runs medial to it. This is a medial view. Right now we are sitting down. All right? So we are sitting on our ischial tuberosities. But have you seen the seats of the professional bikes? So narrow.
Yeah.
So actually, you're not
You're moving
sitting.
as well.
Yeah, and the thing is that you're not sitting on those seats with your ischial tuberosities. You're actually like the seat will
seat
be
is
placed. Yeah, if these are the ischial tuberosities, and this is a seat, so normally you sit on these guys. But if this is a bicycle seat, so then the bicycle seat will be located between ischial tuberosities, and the nerve is passing here in between.
Friction.
All right, so it compresses the nerve, and in the long term, it fucks up the nerve.
How
So-
does that affect the body? Then?
So, once the nerve is over compressed for a long time, it means it would be
Not fun.
like damaged up to some degrees. So in the long term, the cyclists they're gonna have, let's say, perineal pain or maybe some problem with the, let's say, sensation of the penis and so on, because dorsal nerve of the penis is the main sensory nerve of the penis. So they will have such problems like that. It's just good for your own sake to know. Otherwise,
The branches of the internal pudendal artery and external and the nerve are passing in the canal.
Only internal pudendal.
Only internal,
Yeah.
passing the canal?
Yeah.
And it gives all its branches inside the canal?
Yeah, but once those branches are originated, they leave the canal. So basically, the dorsal nerve or artery of the penis, these are the terminal branches, the very end branches.
What do you mean internal pudendal nerve?
No, internal pudendal artery,
Yeah.
pudendal nerve.
Okay.
All the branches inside the canal,
Yeah.
but they leave the canal?
Yes.
And the external, from where it arises?
Femoral.
Femoral?
Yeah,
So
it
you don't
go-
have to
Just know it's from femoral. There will be no idea about it. All right. So that's pretty much here. So perineum is completely done.
What's the external pudendal supply?
Aha. Internal pudendal, let's say it supplies the posterior scrotal arteries. External pudendal, this guy, supplies the anterior scrotal. Yeah. That's the only thing about it. So 15. Okay. We can do the external genitals also. Let me pause this video.